Welcome to the course on ethics at Houston Christian University. My name is Dr. David Frey. I'm a dentist. I have a master's in health administration, and I am on the faculty of a dental school, not only as a professor there, but I also have faculty appointments at 2 medical schools. And my history is that of private dental practice. So I'm coming tonight to talk to you about the perspective of dentistry as it is a part of overall health ethics and medical ethics. But this course is an introduction of ethics of healthcare and the impact of Christian convictions. So my background was I was a pastor's son. And so I grew up in church. I went to Houston Baptist University, graduated there, went on to dental school. And I can assure you that in this process of this course, this is a personal journey for you. You're going to examine what your background is, what your values are. I developed values way before I went to dental school, but as a clinical person, I'm confronted almost daily with ethical issues. And so we are going to be examining the ethics of care, of healthcare, and then how that is undergirded by the foundation of our Christian principles. The Gospel of Luke is authored by a physician. And Luke talks about the great physician. So I would ask that one thing that you might do in this course is to start by reading the Gospel of Luke, but read it with different eyes. Read it from the perspective of a physician and how he looks at the life of Jesus as the great physician and how that relationship between Luke and Jesus actually forms the foundation for his ethical principles. Then we're going to be studying in this course 2 books. We have 2 different textbooks that we're going to be utilizing. I would encourage you to read both textbooks. The first one we'll talk about is written by Kyle Fedler, and it's exploring Christian ethics and the biblical foundations for morality. At the heart of clinical ethics is what we bring from our families, from our background, from our convictions. And so as you read the Gospel of Luke and you start reading the book that Cal Fedler wrote, he talks about Christian ethics in the beginning. He also talks about the discipleship and the teachings of Jesus. We'll be looking at both of those over the next few weeks as we get started in this course. What is considered evidence-based medicine? What is considered best practices? And that changes over time. I'm going to be speaking to you as a dentist, and I want you to understand that several aspects of clinical dental practice make good ethics difficult. Sometimes when we have patients, they look at us and they want us to do something and we're ready to do it. Other times we're ready to do something we think is for their good and the patient's not ready. And so when both the patient and the clinician are in alignment, it makes it a little easier sometimes to make ethical decisions. We know that patients have the right to autonomy. We know that they have the right to determine their treatment. But we also have the important duty as clinicians to make decisions on clinical treatment based on what's evidence, what's been proven scientifically to work. So it's important to understand the difference between what's legal and what might be good at managing risk and then what's ethical, because those 3 things need to interact, and you as a health professional would need to understand the differences. When we talk about professionalism, it's important, and yet it can also be poorly misunderstood. And so many young clinicians are convinced that what needs to be done for the patient is what they've been taught to do. And when the patient doesn't understand that, if the clinician lacks communication skills, the patient and the clinician may not be on the same page. So we need to, as professionals, take excellent care of people. And sometimes the patients that we take care of are unable to evaluate or understand maybe what we should do. At the same time, legally, we must practice within the standard of care and the scope of practice. We have to follow the State Medical Act or the State Dental Practice Act. The standard of care and scope of practice are complicated. They're not well understood. And many times there's disagreements professionally over what is the standard of care, what is the scope of practice. A common example is the use of Botox. And so many clinicians will use Botox for different reasons, but then the scope of their practice should determine where they would use it, when they would use it, how they would use it. And so it's typically impossible to know for certain the standard of care in individual clinical cases. Very, very difficult for us as professionals sometimes to make decisions. Understand the scope of practice, the scope of dentistry in general, and your personal scope of competence. So as a clinician, you might know how to do endodontic treatment or a root canal because you were taught in school, but your personal scope of competence may be that you're not able to do difficult endodontic procedures on upper second molars like an endodontist might. And so that scope of practice is actually based not only on your education, but you have to perform the endodontic procedure to the same level that an endodontist would. And so it gets very difficult sometimes to answer the question about what is ethical. So I'm going to be getting into the different principles of ethics. Understand that professional ethical decisions involve personal sacrifice. There's good practical reasons to do the right thing. When you do the right thing, it's based on what you were raised to do. It's really based on your value system. So before you start talking about clinical ethics, you have to look at what is the reason why I do what I do. Why do I have the motivation to help others? And am I making decisions that are the best interest of the patient or my best interest? And so my foundation from a Christian perspective would be my values. And then I'm going to pay attention to evidence-based and how I'm educated. And I'm going to try to provide care following the best evidence, following ethical principles, but from a Christian perspective. And so that's the purpose of this course. Understand that when you treat people right, they treat you right. It actually is a practice builder. There are a lot of good practical reasons for making good decisions and doing the right thing for patients. Getting back to what happened to George Washington, medical theory said we need to do this bleeding. And so it was interesting. In the late afternoon, George Washington felt like that he was going to die. He looked at his will. He spoke with his secretary about financial matters. And then he expressed to his doctors a wish that he might be permitted to die without further interruption. As his death approached, Washington appears to be struck with a fear of being buried alive. He gathers the strength to ask his personal secretary, "Do not let my body be put in the vault less than 3 days after I am dead." And Washington replied, "'Tis well." And those were probably his last words. Now, what had happened to him was when the bleeding was done, it was administered to actually make him well. The idea was to debilitate the body to the point that the disease had nothing left on to which to work. And this was before the germ theory of disease. People didn't understand what a cold was, that it was a virus. And all these treatments were being administered to Washington, who was willing, but it was to no avail. And so if you ask the question, did his doctors follow the scope of practice of their time? They did. Did the result of their action hasten his death? They did. So as you consider the story about George Washington, I want you to be thinking about the 4 pillars of medical ethics: beneficence, non-maleficence, autonomy, and justice. When we talk about these principles or pillars of medical ethics, we have to define them. And so as you go on your journey through this course, you're going to be reading from Scripture. You're going to be reading from 2 textbooks. The first textbooks that I've mentioned is the one that has been written by Mr. Fedler, and the second one is Clinical Ethics by Albert Johnson. And so I want you to be very familiar with both of these books. I've given you in these modules specific things to read, but I encourage you to read both books completely. Beneficence is to do the patient benefit. And so it seems to be very easy, but sometimes as we look at a clinical issue, we try to make a decision what we think might benefit the patient, and then sometimes it doesn't do what we had hoped. The other pillar of medical ethics is non-maleficence, or to do no harm. And so when we talk about doing no harm, it means don't make a clinical intervention that is not going to help the patient, but in fact is going to harm the patient. So sometimes under beneficence, we make decisions to help, they don't help, and then later we make decisions to do other things that might harm the patient. So that gets to the issue of informed consent. The patient should be fully informed of what might happen when they have treatment, both good and bad, and then they should be given the opportunity to make their own decision. And that can be autonomy. That is the patient saying, I understand, and this is the treatment course that I follow. So sometimes we're constricted in the type of care that we're going to recommend based upon the patient's ability to pay. At other times, we have patients who are in pain, and we have a duty to get them out of pain, regardless of their ability to pay. So I think there are two things kind of working in tandem there from patient autonomy. And then lastly is the pillar of justice. And this is really fairness. This gets back to access to care. Should every patient have the access to the care that they need? Dentistry has added another ethical pillar, and it's called veracity, or truth-telling. And so it's just really to be more transparent with the patient. And that also gets into the area of patient-informed consent. When we talk about ethics and clinical ethics, clinicians must understand ethical issues, such as informed consent, the capacity to make a decision. For instance, a patient that might have early onset dementia might have limited decisional capacity. Can others make decisions? Can there be surrogate decision making? Truth-telling or veracity that I mentioned, confidentiality, privacy, the distinction between research and clinical care, and end-of-life care. Clinicians have to apply all of these, each and every day in their practices. By clinicians, we mean not only physicians, not just dentists or nurses or social workers, psychologists, clinical ethicists, medical technicians, chaplains, social workers, other people responsible for the welfare of patients. We also include students who are preparing to enter these professions. Ethical issues are embedded every day in clinical encounters between patients and clinicians. The technical and moral aspects of patient care are inseparable. The central feature of the clinical encounter is a therapeutic relationship between clinicians and patients. And we think of that relationship as being dependent on ethical responsibilities. I like to use the term bond of trust. We have to build a bond of trust with our patients. They have to understand, and we have to understand them. When we enter that doctor-patient relationship with a professional identity, we have to give priority to the patient's interest. We have to listen to what they have to say. We have to communicate honestly and with compassion. So in the words of Hippocrates, we are to help and to do no harm. I think in this course, as you study the textbooks, you're going to be faced with a decision. Will you be a fixer or a server? Will you look at your patients as broken? That's the concept of a fixer, something to fix. Or would you listen to your patient and serve them? Understand that we have an opportunity for effective, preventive, and integrated health care, and it's an essential part of the dignity and respect that we should be giving all of our patients. So as you look at this slide and ask yourself the question, what will I be? understand that this decision is not just a one-time decision. You're going to be confronted with this daily in your professional life. This is an example of a patient that I saw many years ago. And what's interesting about this patient is that anyone would look at this as a failure. To me, when you look at the molar in the posterior area, it has a crown. This was a patient that was capable at one time of affording dental care. But the basic preventive dental care that should have prevented what we see here as a result was not successful. So when we think in terms of how we serve patients, we have to fix what's broken, but we have to serve them in ways that maintain their health. And so these are ethical issues. So I want you to be considering those ethical pillars as we go through the textbooks. In the clinical ethics book by Mr. Johnson, you're going to find case studies. As you look at those case studies, you're going to make a decision on what you would do. You can put yourself in the place, and then you can examine these case studies and examine what the author says. And I think it will really help secure a good, solid foundation. So as a dentist, I speak to you as a person with a background in dentistry. We have to listen to the patient. In the case of a child, we have to listen to the family. And preventing disease is our first priority. We have to plan for function. We have to plan for people to be able to eat and have good nutrition. We have to prevent pain and discomfort. We have to establish the bond of trust with the health team. These are really the goals of oral health care. So what was the ethical principle? When you looked at that picture of that mouth that was a failure, it was a result of possibly poor oral hygiene at home. It also could be a reflection of poor salivary capacity. Patients that have had radiation that's destroyed salivary glands can have rampant decay. So there are many things that are going on, and you look and say, well, what was the patient beneficence? Was treatment done? Was there patient autonomy? Did the patient fully understand their obligation for health care? So I think we, as a professional, we have a duty to protect the patient from harm. We need to make sure that our knowledge and skills are current. We need to know our limitations and know when to refer. We also need to know under what circumstances delegation to other health professionals like a dental assistant is appropriate. So there are many things that we can do with in a dental office with oral hygiene instruction that we don't have to do as a dentist. But we also need to realize that our patients deserve our best. This is another patient that I found very interesting as a dentist. This is a patient that, if any of you have had a dental background, you would understand that this patient does not have bleeding gums. They actually have excellent oral hygiene, and their gum tissue, their gingiva, is very, very pink, very, very healthy. They also demonstrate extensive toothbrush abrasion. So in other words, they brushed with too much pressure. At the same time, this person has had a lot of decay. So you see the black places on the teeth. And so there's a lot going on here. There may be medications that are being taken that are reducing salivary flow. There may be reasons why. And so one of the things we have to do as a clinician is we have to identify reasons why things don't work. So understand that the mouth tells a story. We can ask all these questions and then understand there could be a better outcome. And so lastly, I want to close with this. As you do the biblical reading in this week's assignment, think about, how do the teachings of Jesus to his disciples inform our ethical principles? How will my future health plans shape my values? And what's the difference between professional ethics and personal values? So thank you for taking this course, and I hope that you enjoy all of the readings that you do, and I hope that it has a personal journey impact upon you and your personal ethics and your professional ethics in your future career. Thank you.